but we do want to provide an update on all that violence that happened on Monday in Grand Rapids. Like Matt said, 3 people found dead just blocks away from each other in a span of a few hours. The victims identified this week as Anaya Rodriguez, Malik Eubanks, and Daryl Yarber.
While the investigation into their deaths is ongoing, our Julie Dunmeyer spoke with U of M's Institute of Firearm Injury Prevention about the cause and effect of community violence and how to respond.
All this week, neighbors and officials have responded to this tragedy as the community continues to grieve. Today, we sat down with gun violence experts about the root causes of these issues.
Dozens of onlookers amidst a crime scene in Grand Rapids on Monday. Dr. Patrick Carter with the University of Michigan Institute of Firearm Injury Prevention says this shooting is merely a sign of the times.
Well, we know that firearm injuries, firearm violence has been increasing, especially interpersonal violence, as a cause for these types of outcomes, these firearm homicides.
Saying intrapersonal firearm violence has been on the rise nationwide since before the pandemic.
We know there's a cycle of violence, so oftentimes one incident portends additional incidents in the future. That retaliation is a key driver of some of these incidents.
Dr. Carter says changes need to be made for events like Monday to become a thing of the past.
Efforts for prevention are really focused around how do we break that cycle? How do we interrupt that cycle of violence?
He says the cycle can best be broken at the individual level.
You know, there's individual things we can do, things one-on-one with people to decrease their involvement in violence, addressing issues around conflict resolution that occurs in nonviolent ways, anger management, reducing risk factors for violence involvement, things like substance use, and addressing mental health issues.
But adds that addressing systemic issues at a community level is a key part to the puzzle.
How do we change the nature of neighborhoods or communities where there may be high levels of violence? And so how do we invest in those communities, address issues like unemployment, address issues like homelessness that may be driving some elements of the violence that we're seeing?
And witnessing these events can have lasting impacts on communities.
We know that these incidents are not single incidents that involve just 1 or 2 people. Often these things involve a community that surrounds people, and the effects of that on the community are huge. We know that there's mental health outcomes and trauma that occurs as the result of exposure to perpetual violence in communities.
The University of Michigan Institute of Firearm Injury Prevention runs 2 anti-violence programs in West Michigan. One is Safer Teens, which is violence intervention programming based directly at Trinity Health Muskegon Hospital, and the other is the Michigan Youth Violence Prevention Center. For now in studio, Julie Dunmeyer, Fox 17 News.